Hi, this is Chonk, and he's going to be in my video while I talk about anesthetics and hamsters and the complete steps on how to sedate a hamster. So before we perform any physical exams or anything to do with the animal, we'll go over first how to properly handle a hamster. They are nocturnal, so they will be mainly sleeping at nighttime, but since we usually would be performing the surgeries during the day, you're just going to want to gently wake them up, not to startle them too much. They can get pretty scared pretty easily, so you just want to make sure you're going slow, and then you can cup them in your hand to pick them up. And then when it comes to actually restraining them for either an injection or a physical exam, I will show in the next clip how to properly restrain them. So while restraining a hamster, they are a little wiggly, so keep them contained, and then you're just gonna push them closer to the floor and then pick up all their back skin, and they're restrained like this. So this is where we can do some of the injections. So now that we know how to properly hold and restrain a hamster, we're gonna be performing our physical exam just like any other animals, like dogs, cats, horses. Everything is standards because we need to make sure that our patient is healthy, and if there's any concerns, then we can check this through the physical exam. So while restraining the hamster, we're going to be looking at its hydration status, we're going to be doing its temperature, heart rate, and resp. And we're also going to be checking its eyes, ears, and nose for any discharge, and also making sure to look if any overgrown teeth are occurring or if there's any dental disease, which is also common in hamsters. So when it comes to fasting before surgery, that is a common protocol when it comes to dogs and cats, but with hamsters, we do not want to fast them. They cannot vomit, so these animals should not be fasted, and it can even cause GI upset, or it can also cause hypoglycemia. So we want to make sure that we're not fasting them, and we can even leave the food in the cage 1 to 2 hours prior to the surgery. Unless it has to do with an abdominal surgery, then we will take the food away 3 to 4 hours prior. So usually for species like dogs and cats, we would intubate the patient to deliver the oxygen and anesthetic gas. But with hamsters, their airway is too tiny and we would not be able to intubate, so that is why we use the gas chamber and intubation chamber to fully sedate them. We can get into actually anesthetizing a hamster. So to begin, there are a couple different methods that you can use, but the most common one is by using an injectable anesthetic, and then anesthetic chamber, and then also by maintaining the anesthetic with a gas mask. So to begin, we would use an injectable anesthetic. So the chart above does show the recommended doses from the textbook. This would include acepromazine, diazepam, dexmedetomidine, and an opioid such as buprenorphine, which are the most common drugs that you can use. So while that has been done, then we can put the animal